Health Check with Nurse Jenn is presented by Island Cancer Center.
Day, I'm Nurse Jenn, and it's time for your health check. Stevens-Johnson syndrome is a rare but very serious disorder that usually occurs as a reaction to a medication or an infection. It often begins with flu-like symptoms, followed by a painful red and purple rash that spreads into weeping blisters throughout the entire body. Ultimately, Stevens-Johnson syndrome is a medical emergency because the affected skin can die, shed, and not regrow back. It's crucial that doctors and nurses work together in an attempt to heal the integumentary skin infection before additional complications occur. The end goal is to help the skin regrow, but this regrowth can take days, weeks, even months, depending on the severity of the condition, age of the client, and prognosis. If Stevens-Johnson syndrome was caused by a medication, it's important to permanently never use this drug ever again or drugs in the same pharmaceutical classification. If you are currently taking multiple medications, be on the lookout for signs and symptoms related to Stevens-Johnson syndrome. These symptoms include a fever, unexplained widespread skin pain, a red or purple skin rash that easily spreads, skin blisters, and even blisters in the person's mouth, nose, eyelids, and genitals. Advancement of the disease includes skin shedding within days after the blisters start, forming with pain in the mouth, throat, and eyes. If you've been diagnosed with the herpes virus, pneumonia, HIV, or hepatitis A, these infections will, with multiple prescriptions, have been associated with Stevens-Johnson syndrome. Multiple medication therapies associated with Stevens-Johnson syndrome include anti-gout meds combined with anti-seizure and antipsychotic meds, while simultaneously taking over-the-counter pain relievers such as acetaminophen, ibuprofen, and naproxen with antibiotics such as penicillin. This diagnosis is considered a medical emergency because it can ultimately lead to sepsis, cellulitis, eye and lung complications with permanent skin damage. There's often no way to know how you'll react to certain medications, but if you are of Asian descent, you may have the gene that increases your risk. Prevention starts by buying a medical alert bracelet that clearly shows the name of all the medications that you're allergic to. This will help the doctors to avoid prescribing these medications or any medicine that falls into the same classification. Research clearly shows that when an individual plays an important active role in their own health care, complications are less likely to arise. So it's important to know your body and be able to self-identify abnormal symptoms. It was great hanging out with you, Esta. Till next week, same place, same channel. I'm Jenn Artero, registered nurse, reminding you, don't wreck yourself, health check yourself.
Health Check with Nurse Jenn is presented by Island Cancer Center.